him in, I'd greatly appreciate it.
Hello?
Hi. Let me just go ahead and open up. You're right on time. My
Okay.
name is Marcia Ellison. I am chairperson for the State Civic Engagement Committee. I also am president of the NAACP Fort Lauderdale Broward branch. I want to thank everyone for appearing here. We have been just outraged about our children's lives being placed so little value being placed on our children's lives here in the state of Florida. We are certainly at the top of the worst list when it comes to COVID-19. We are certainly an epicenter, and we know that the numbers for our children are going up, and so the COVID numbers are going up. So we wanted to have a conversation about COVID in Florida schools. If you won't mind, we'll start with open up with prayer. So, Minister Edwards, if you will lead us, please.
Let us go to the Lord in prayer. Eternal God and Father, we thank you for yet another day. We thank you now, Father, for this opportunity that we might come together as a community of concerned citizens for the welfare of our children. Lord, I pray that you would be in our midst on tonight. Let us be mindful of the task that lies before us. Give us the strength to carry forth. In your precious name, I pray. Amen.
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 Thank you. Um, as always, we will open up hearing words from our president, our fearless leader, Dr. Adora Nweze. President Nweze, the floor is yours.
Thank you very much. Good evening, everyone. And certainly to our number one president, President Marcia Ellison of the Fort Lauderdale Broward branch. I am telling you, I've been just telling everybody who listened to me, just the idea that this leadership under Miss Ellison have just put everything in on time. We had no idea when you started these series that we would be here at this time and holding this whole world in our hands for helping to turn it around. So I want you to know that we are proud of you, President Ellison, and proud of the branch. And I'd like to let you know that we are here to do anything and everything we can to come together. And let's see if we can't resolve this matter so our children can at least live first. Right now, we want to keep them alive. And then we certainly want to make sure they get a quality education next. So it's delightful for me to be here. And I certainly want to jump in when it's appropriate.
Thank you, Madam President. As you all know, we always say in the NAACP, membership has its privileges. And so I want to take an opportunity to introduce or present a great friend of the NAACP, a life member of the NAACP, and we have a long history. And I wanted to find out just where our I'm gonna call him governor because he was certainly our governor, and you know, 22 is coming up. But I wanted to hear from a friend of the NAACP and to see where we are on this COVID, because we are certainly in a state of emergency. We are worried about the lives of our children, and with all the threats and what have you coming out of Tallahassee, I wanted to hear another voice who has occupied that office. So if you will receive our own Governor Charlie Crist.
Well, Marcia, thank you so much. It's an honor and a privilege to be with you, and certainly Adora, my dear friend forever, who actually made me a lifelong member of the NAACP, and I'll never forget that, and eternally grateful for it. We are in a crisis. Marcia, you are correct. The current governor doesn't understand, obviously, the value of life. He understands the value of politics. And that is a sad state of affairs for all of us. And we need to change it. And that's why I'm running for governor. I love Florida. I love her with all my heart. And I know she deserves better. You deserve better. The people deserve better. And what we're witnessing now is the most raw form of politics I've ever seen in my life. To put his pursuit of the presidency and the Republican nomination in 2024 above the people of Florida is inexcusable. It is unacceptable. It is untenable, and it cannot stand. And in a poll last week, we're already beating him. And I'm not surprised because the people of Florida are smart and they understand what having public servants who have empathy and care in their heart means. And so I'm honored to have an opportunity to be with you this evening. I love the NAACP. I love each and every one of you. And I look forward to the campaign ahead. I was supposed to be already in Miami tonight, but we had a lot of bad weather in Tampa Bay. It's home of the Tampa Bay Lightning. That's not an accident. We have that name. We had a lot tonight. I want you all to stay safe. Look out for our children. You know, this governor saying that they shouldn't wear masks is unbelievable. Him not going around the state day after day as he should be, as I would if I were there again now, encouraging people to get the vaccine. This is not complicated. What he's doing is making it difficult, and regretfully and so sadly, it's costing lives of our fellow Floridians. God bless you all. Thank you for letting me speak, Marcia, Madam President. And Adora, I love you forever. God bless you. Thank you so much.
Thank you.
God
Thank
is good.
We appreciate it. I wanted to, you know, I always, we always say, we've been saying that we want to hear follow the science. You know, follow, what does that mean to a lot of people? Follow the science, follow the science. Well, we've brought in our own Dr. Sheridan Major Moore. Dr. Moore, if you will introduce yourself and then tell us about the science that we are expected to follow that seems to not be making its way through Tallahassee. Tell us about the science, Dr. Major Moore.
Hello, good evening, everyone. I'm Dr. Sheridan Major Moore. I'm the Clinical Director and Infection Control Officer at Broward Community Family Health Center, passionately known as BCOM. I'm family medicine by training with a master's in public health from the University of Florida. I love my patients. I see everyone from cradle to grave. So, and you can't help but fall in love with the kids. You know, if you have a panel full of adults, those few pediatric visits that sprinkled in just light up the world. Just make your day better. So, of course, we all want to make sure that they are safe. Now, there is no doubt that there is tremendous benefits to in-person learning. You know, the CDC stands behind that. The American Academy of Pediatrics stand behind that. The American Academy of Family Physicians stand behind that. But we need to do it in a manner that is safe for everyone, for the kids, for the teachers, many of whom have chronic diseases themselves, underlying conditions, and would not respond well if they became ill, for their families. You know, when it comes to infectious diseases, more often than not, it's not just one person affected, but everyone in their circle. And our circle gets bigger, right? Because we go to the grocery store, the pharmacy, gas stations, multiple places. So it's incumbent on us to think of all of those people and everyone that we're coming in contact with. Now, a lot of the rules were relaxed as our numbers went down, and that was appropriate. But more recently, we've seen where we are in the midst of a surge and our numbers are going up. And even more so now, our children are more greatly affected by the Delta variant than before. So, you know, we have more kids that are hospitalized. We have more kids that are ill now than we did initially. So of course, guidance changes appropriately, right? The guidance that's put forth by the CDC is very well written, and they give plans, operational plans. It's a well-written plan. But the takeaway from it is that the best way to approach this is to include screening, like screen testing. The rapid tests are available. Ventilation, hand washing, respiratory etiquette, okay? Indoor masking, okay? Staying home when you're ill, quarantining, if necessary, isolating, contact tracing. These are all parts of that plan. Of course, we want as many people vaccinated as possible, right? We need to get as many people vaccinated as possible, but not all our kids are able to be vaccinated, right? What about everyone under the age of 12? So all of our kids are not able to be vaccinated at this time. Science tells us that the best thing to do in this situation is to wear a mask. Okay, if everyone is going to be sitting, and one of the things that's mentioned in this plan is putting kids 3 feet away. Well, I don't know if every school is going to be able to put kids at that physical distance away. So we're then going to put everyone close to each other without masks and without vaccines. This is not a recipe for a good scenario. The best solution or the best scenario, I would say, would be to follow the guidance that the CDC has put forward. I'm in a health center and we're following the guidance that the CDC has put forth. And we're adults working there. These are kids. They are expecting us to be the ones to look out for them and to take care of them. So we should do right by that guidance.
Okay. And so we have a parent who has children, who's had experiences with COVID, and these Mr. Hosey is from our Brevard County school system. Mr. Hosey, I know you said you have 3 children. Will you share with us the experiences you and your family have had as you made the difficult decision to send your kids back to in-person school?
Yeah, I can talk about that. So my experience is very personal because here in Brevard County, we actually were sort of the early adopters to this optional mask idea, which began in June. Right at the end of the school year, they took away the mask mandate here in Brevard County. And my 2 kids went to the summer program at their public school and didn't make it more than 2 months before cases constantly broke out. My kids wear their masks. My kids, did everything that they were supposed to do, while many in the building, including staff, did not. And we found out, that doesn't work. We need everyone wearing their mask indoors. And so what happened was my oldest son, who was 8, caught COVID, along with 11 other students that day who tested positive. And so I had to, as a family, we had to learn firsthand what it's like to isolate a child from their siblings and the rest of the family, to experience the fevers, the chills, the coughing, and many other students. The other 10 students that day, the following day, I received a letter from my younger son's classroom, and there were other kids that were positive. So there's was an unknown amount of positive staff and students, as well as quarantine cases. And to me, it just taught us firsthand that some wearing masks compared to everyone wearing a mask is totally different experience. My kids both went to school all last year. They began as e-learners and continued through that school year as in person, and masks were required. And we never had an incident So it just goes to show in that short period of time, especially with this Delta variant, it's very contagious and it's something that is preventable, but we have to make wise science-based choices to protect our children.
And so did school start again, Mr. Hosey there?
Yes, school has started on Tuesday. We decided not to go through that experience again. And we actually removed our two boys from the public school system and sent them to a private school that requires masks.
Would that be your first choice, or was that your only choice that you felt like you were with?
Well, my first choice would be for them to go to the public school around the corner where their friends are, where they're familiar with. So this was a choice that, of course, it was tough. It was a tough decision to do this because it required us to drive 20 something minutes away. It requires a lot from us as we have to, work and continue to provide for our family. So it was not the choice we wanted. It was not really the most optimal, but we had to do it for the safety of our kids.
Thank you. And so I saw just today that in was it Palm Beach County, 440 students have been asked to quarantine, with 51 students and I think 10 or 11 faculty with confirmed positive COVID cases, and just after only 2 days in the school. And let's talk, since we're talking about school, Dr. Osgood, you are the chair of the sixth largest school district in the nation. We have, I believe, somewhere around 270 plus thousand students and parents who are looking for leadership from Broward County School District here. And so tell us how you have been able to keep the vote where it should be and not allow the district to allow the governor to bully you all into playing Russian roulette with the lives of our children and their families.
Thank you, Madam President. And, it is a very difficult place to be at. Our school board is made up of all mothers and one expecting mothers. And 8 school board members voted to make masks mandatory and suffer whatever the consequences. And it's interesting because when you look at that makeup, I'm the only African American. We have a Jewish school board member, Latino, and 2 Caucasian women. Actually 3 Caucasian women, and all of us voted to continue to mandate masks. As you all recall, we had a tragic incident in 2018 where 17 individuals were murdered at Marjory Stoneman Douglas. We lost 14 kids and 3 adults. So it took us to a whole nother level of consciousness about people being killed in school. In 2008, at Dillard High School, an African-American girl was killed in school. When people send their children to school, when they go to work in schools, they volunteer in schools, schools have to absolutely be a safe place. So tonight, we're not talking about gun violence, but we're talking about a global pandemic that's just as deadly. The global pandemic, this coronavirus, will not only kill you, you can survive it and be left with a lifelong issue that you now have to suffer with. So it's very important for everyone to know that schools in Florida right now do not have an option to do hybrid learning. After the governor emergency order expired, it took away our option to do virtual learning, in the sense that you would have a teacher using synchronous learning where they're using technology to teach to a student in the class and the students online. You can always go to Broward Virtual School or Florida Virtual School, where you will get curriculum and support, but you would basically have to teach and do a lot of the work yourself as a parent. So the first executive order that was issued when the positivity rates were a lot lower, schools were closed, the county was shut down, and we were in a state of emergency. The positivity rates in Broward County right now are almost at 20%. In the state of Florida, the same thing. But we're not in a state of emergency. Although we've had an executive order and 2 emergency orders, one from the Department of Health and the other from the Department of Education. And the executive order declared that parents' rights to mask their kids was the way that we should go, and that school board should not make masks mandatory because we would take away a parent's choice or a parent's right. Well, if I decide that me and my children are going to smoke in my house, and we don't, but if I made that decision and I allowed that, that would be my choice and my right to do that. But I couldn't send my children to school and have them smoke in school. Those of us that have children and grandchildren, when we put them into a car, we have to do what? If they're under a certain age, put them in a seatbelt. And you have to have a certain kind of seat to do it. As a parent, I don't get to choose that my child cannot be in that seatbelt or wear that seatbelt. So when it comes to masks in school, there is no way with class size at 26, meaning you're going to have at least 26 students and 1 or perhaps 2 teachers in a classroom. It is not logistically possible to practice 3 feet or 6 feet of social distancing. I find it very interesting that the ruling that came from the Department of Education said that we had to practice 6 feet of social distancing when it's not logistically possible. When I put 60 students on a school bus, I can't practice social distancing on that school bus. Even if I let the windows down, it's not possible. We have put all types of safety protocols in place. It's how we came back to school face to face. Data has shown us through grades, through increase in suicides, a lot of mental health issues have come into play around children being at home. So if you bring everybody back face to face, you have to use a tool that can help not spread this airborne pandemic that's killing people or leaving them with lifelong complications that they suffer with for the rest of their lives. And we know it as a mask or a face covering. So when you think about those dynamics, most school districts have gotten an opportunity to invest in PPE for children who can't afford masks, or if the mask or the face covering is dirty. Teachers and bus drivers are given supplies of masks and sanitizers. School districts are cleaning in a different way, where we put in things to help the air circulate better. We've done every possible thing we could to make sure that our schools are safe, because we lost 17 individuals in a school, and we don't want another adult or child to die or contract this virus that could kill them at school. So when you think about safety, which is always a priority in school, you think about the laws around school safety, you think about the OSHA laws that we get from the federal government, then you look at science. You know, I'm a graduate of the Broward County Public Schools. Most of y'all know my story. I didn't learn how to read to the end of 3rd grade, but once I got it, I read everything. When I look at science, when I look at doctors, constantly tell us over and over and over again that we need to wear masks. When I see people dying and hear their stories, when I have lived experiences that people that I know have died from COVID. We've lost 4 staff people this week who were not back present at school, but died from COVID. Many of our staff had COVID during the earlier variants of COVID and survived it, and now are living with those lifelong complications with issues to their lungs and their hearts that I spoke about earlier. When I think about the being who is more important to me than any other being that I call God, and the moral obligation I have just as a human being, it is no way under any circumstances that I will ever agree to bring a group of people together in a classroom, a school bus, or a cafeteria and have masks be optional. I can swing my arms. My right to swing my arms go as far as your nose. Just because I have the right to swing my arms, I can't just hit you in the nose because it's my right to do so. When our individual rights begin to impose danger or harm to others, we have no individual rights. So for the governor to constantly bully, constantly threaten school districts because they're simply trying to care for the people that they love, work, live, and play with, it's unheard of. I could never imagine being a student of public administration, being a policymaker for 9 years, learning from other great policymakers like Judge Holmes and Representative DeBose, and I could just go on and on, Roosevelt Walters. I could just go on and on with the list of people that I grew up watching deal and do public service before any of us were in the seats that we're in now. It's no way that I could bring kids back to school, teachers back to school, cafeteria workers, bus drivers. Broward County Public Schools is the largest employer in Broward County. We employ over 30,000 individuals. All we need is one COVID outbreak on any school campus, and it goes home to the community, and it begins to spread literally across Broward County, because you know we all connected in one circle or another. So when you just think about it, you don't even have to be that intelligent. You don't have to have a PhD or even a GED to understand the value of human life. I have decided that the people that I love in this community, their lives are invaluable. And I have 7 other board members that believe the same way. We will not put a cost on people's lives. So there was a threat immediately after we issued that we was going to stay with what we had put in place. Within 2 hours, we had a letter threatening to withhold our salaries. So I said, I don't understand this. You know, how can the taxpayers' money that's taken up through our property taxes and other means go to the state, be given to the government, and then they use it to blackmail local school board members that were elected by the local citizenry to enact laws and govern over schools? How does the governor take voter suppression now totally off the charts? We went through this legislative session. We saw all of this horrific policy come forth to suppress our vote. So now we're in a fight where our votes have been totally eliminated because the people of Broward County elected the school board, local school board members to govern over the school. So the governor is saying, I don't care about your vote. I don't care about the people that you've put in place to represent your interests. They're going to do what I say, or I'm going to punish them, or I'm going to bully them. Well, for those of you all that are from the hood like me, when you draw the line in the sand, we're going to come across the line every time. We was born that way, made that way. We do it all the time. So we decided to go across that line in the sand. Today, there was something came out that said the governor does not govern our payroll, so he can't take our salary, but he can take money that would go to our general fund, and in good faith, we would withhold our own salary so that we don't take money from the kids in the classroom. What responsible policymakers use kids as a pawn to get their way? This is a democracy. The last time I checked, maybe they had a secret meeting last night that we didn't get invited to that changed that. But this is a democracy. You and I don't have to vote the same way. But once a vote is taking place, once a group of local officials are put in place to govern, their decision-making should come forth and it should be allowed to take place because they're living with those people every day. I would love to invite Governor DeSantis and Mr. Cochran to Broward County to go with me to the hospitals that are at full capacity now, to go with me to our schools and see my beautiful children that are there, the teachers that are there. I would love to just let them go through the thousands and thousands of emails that I've received of people begging for masks and protection for their children, encouraging us to stand up, encouraging us not to put their children at risk, not to put their lives on the line. The staff that's saying, hey, I already have different ailments that I can't take a risk. A teacher who is the sole breadwinner in his house, has a daughter with brain cancer, a wife with breast cancer. I'm going to put him in a classroom and risk him getting COVID where he can't provide for his family. He infects his daughter and his wife, and they probably won't make it. Even with people that have been vaccinated, this new strand of COVID is impacting them in a significant way. They're only staying alive because they had already been vaccinated. This is a serious, serious health crisis and epidemic that we're in. And there is no governor or no person on this earth that could ever intimidate me in a way that I'm going to risk people's lives. At the end of the day, I know who is the supreme authority over my life. And they don't live in Tallahassee. You know, they don't get on TV and talk shade without coming to the community. It is just unconscionable to think about those types of things going on in Tallahassee. Nobody's thinking about how the children feel as they see all of this playing out before them, wondering who's going to stand up for them. How are we going to allow them to be assaulted in this way, put their lives on the line? So we have held fast. We will continue to held fast. We're not going to change our votes. We don't even have it on an agenda to even have another discussion about it. We're going to protect the people that work in Broward County schools, the children that attend school there, and this community, because what takes place in the school system ultimately impacts the entire community. So then finally, you have with that a Hope Scholarship. You create this new terminology. So now if I get a kid at school, because masks are optional, and I put them on one side of the room, or I put them in a separate room, I'm guilty of COVID harassment. A new term. So now they can take the Hope Scholarship and go to a private school. I took the time to call several private schools yesterday, and guess what? They are mandating masks. They're not letting people in without wearing masks because they know that it is what we should be doing at this time. So people pull their kids out with the scholarships and they go to these other schools that they have to pay for. That disenfranchise most of the kids that look like me because their parents don't have $22,000, $30,000 a year to pay for them to go to those schools. So you continue to attack public education because you know that it is a necessity for Black and Brown students. You continue to take the resources and the money away from it. You continue to impose trauma upon these kids that make it almost impossible for them to even think about a test because now they're thinking about staying alive. What about the teacher? How would the teacher manage who's opt out and who didn't opt out? How would the bus driver deal with the kids on the bus that's gonna say, you don't have on your mask, get away from me, I'm gonna bust you in the face because you're gonna give me the coronavirus. And you know, once kids start mixing it up, then what? They're gonna want us to call the police and lock those kids up. This is the worst fiasco that I've seen in my lifetime. This is actually worse than a lot of the stuff that Trump did. Trump would do his stuff through other people, but he never had an outright attack on children. No, who do we know devalue the life of children? Children are a blessing from God. They are our most precious commodity. Many of us will give our lives to save kids, to keep kids. We spend countless hours mentoring, giving money, doing whatever we need to do to help kids. And we have a governor that says, make masks optional and let the parents choose. Well, parents don't get to choose which one of my kids gonna die, which one of my kids gonna sit with COVID, not on my watch. And we have to have an outcry. If we don't stand up now and fight for our kids in a very aggressive way, as people across color lines, as people across neighborhoods, even the people that don't look like me that's in the west side of my district, District 5 is the east-west district. is predominantly African American, but there is a Caucasian part of the district. And even those people are also on board saying that we need to mask the students. So DeSantis does not get to rule. You know, I'm kind of in a Dietrich Bonhoeffer spirit right now. When Hitler went to Bonhoeffer and tried to get him to deny his faith and turn against what he thought was morally right, he was willing to go to prison and ultimately be killed, not to compromise of what he believed. I can't compromise. I always value the life of people, and I'm going to treat every single child and every single person like I would want them to treat me, my grandma, my granddaddy, my children, and my grandchildren. We cannot just sit back and let this go down. Madam President, I thank you for your support and leadership. Sarah Adora, I thank you for your immediate response and connecting us to NAACP on the national level. I thank Bacardi and the Southern Poverty Law School for what they've done to weigh in, and all of the other groups that have said, we have y'all back, we gonna stand with y'all. And so we've also received emails. I received emails yesterday from people in Hawaii and different places. And at the end of the day, y'all, I'm gonna go with my community. That's all I know, that's all I got. So if my money is taken away, you know, I can get Judge Holmes to set me up a GoFundMe and make one pitch, and it might be by way to become a millionaire. Then I can pay for and build our own schools that we can educate and take care of our own kids. But this is absolutely ludicrous that we would have a policymaker that would use children as a pawn and try to bully and threaten a group of women, especially women that are African-American women. This nation is built on our backs. We're the soul of this nation, and we've never been scared. We've never backed down to any challenge, any fight that we was invited to. So I am standing. I will continue to speak out. Representative Bosch, you'll like this. I got a call today from one of your colleagues that wanted to just kind of drop a bug in my ear to say, you're running for Senate and you're probably going to win. The governor's going to be so mad at you, he's not going to allow any of your bills to be heard on the floor. I said, that's great. Thank you for giving me a heads up. I'll start saving my money now. So I'll have the money to charter at least 7 buses of people from my community, because that's the cultural diversity training that they sleep on. When you come in the community and bother one of us, when we show up, we're going to bring the whole community. So I'll be taking 7 bus loads of us up to Tallahassee. The whole press conference is up there to talk about bills that's being blocked because the governor mad. It's just ridiculous. And I want our kids and our parents to know that we love you. We're going to fight for you. We're never going to allow anyone to bully us or intimidate us in a way that's going to put your life in danger, to devalue who you are as a human being. We love you too much for that. So we're standing, and we're going to continue to stand. And my prayer is that we not only stand, we send emails, we write letters, we talk in every opportunity we get in the public to educate people about this and what's going on. We have to stop this, what's going on now. I began to think about my parents in their day, and I'm telling you, we need a revolution now. We need radical response. We cannot allow the white rage that continued to happen in public policy to go down, and we just talk about it for a little while and we go away, because we're suffering more and more and more. And we have the power, the intellect, and the resources to make the changes that's needed. And it starts now, because somebody decided they was going to go after kids in Broward County. We're not having it.
Thank you, Doc. We appreciate you. And so can the governor actually go through with his threats of taking folks' money and taking the district's funding and defunding the schools, defunding our school leaders' salaries? Let's go to Attorney Bacardi Jackson, Southern Poverty Law Center. Attorney Jackson, how much of this is an empty threat, and how much legally can he do?
Thank you so much, President Ellison, for having me and for raising this important issue. as an advocate for the 3 million children, almost 3 million children in the public schools across Florida, as a mother of 3 of those, Dr. Osgood, I want to say thank you for your courage, for your bold leadership, for your refusal to back down, and for your commitment to protecting our children's lives. We need you in this moment, and you have been the woman who has been set on a platform to lead this charge. So thank you for taking that up. I want to put this in context, if you don't mind, a little bit. I think one of the things that's really important to understand is that there are some serious motivations behind what has happened here. One of them is an attack on public education and the persistent move to privatize our education system and really many of our public institutions. And so we saw with the expansion of the Hope Scholarship, and that laid bare this motivation. That's what this is really about. You heard Mr. Hosey talk about the impossible choices that parents are facing, and the solution that's being put in front of them is we will take you away from public schools and put you in private schools. And we are in a state that already leads the nation with $1.2 billion a year being siphoned away from our public schools into private voucher schemes of many sorts in order to do that, to meet that agenda of privatizing education. Follow the dollars and understand what's at stake here. And we are doing that at a moment when we are 45th in the nation of per pupil funding. So we sit at about $4,000 less per student per year than other states in our country. So we are pitifully funding our public school system while we are constantly trying to undermine it. And that's one of the things that this is about. The other thing that this is about is the utter disregard for the lives of the children who attend our public schools. If you look across the Deep South, you will see that about 1 in 3 students in the Deep South are living below the poverty line. More than half of the children in public schools are considered low income, and about 1 in 3 of our students are Black across the South. And so there is a real disregard for whose lives are at stake, and that is no accident either. We are also seeing in this move the continued overreach and expansion of the executive power of the governor, where there is complete disregard for the authority of our locally elected officials, the people who we as the constituents in our communities have elected to make the decisions and to operate things like our school districts. And our governor is literally reaching down saying he can decide what we have for lunch on Thursdays. That is an inappropriate exercise of executive power. And then finally, we know the motivation is to galvanize this base, to politicize something that is not political, a public health crisis, and that's intentional as well. So we have to keep our eyes on understanding the larger game that's at play so that we can understand how we have to come out in real force to respond to it. It is not something that we can afford silence in this moment. So let me just talk a little bit about the violations of the law here. First and foremost, as you may have already heard about, there are already some suits that are already being filed across the state. One of them right now that's in federal court is raising this issue, which is that the governor is violating federal law in pushing this agenda. There is the Americans with Disabilities Act, IDEA. Those are laws that protect medically vulnerable students with disabilities, and they have a right to a free and appropriate education in the least restrictive environment, which means they have a right to go to school like everybody else. They have a right to be in the classroom like everybody else, and they should not have to risk their lives to do it. And that is exactly what is being asked of parents who have children who are in that situation. It is not something that can be done under federal law. The other thing that's at issue and that we've seen already happen in some of the states, like in Arkansas, I believe a judge just came back and said there is no rational basis under equal protection for you to treat public schools differently than private schools. There is no rational basis, whatever your, if you looked at the executive order, there's this ridiculous science that's quoted in it about masks may cause you to harm because of bacteria or some such nonsense. But clearly that is not the real interest or issue, because if that were the case, if they really, really believe that, it would apply across the board. These regulations apply only to public schools, not the thousands of private schools that are in Florida, including the many of them that get tons of public funds. And so if you want to withhold public funds to enforce something you really believe was in the interest and health of children, you would apply that evenly across public and private schools. And that is not what's happening, because that is not the real agenda. The other thing that is notable is that there is a real disparate impact on communities of color. We know that COVID is impacting our communities at a much higher and greater rate for many reasons, for lack of access to healthcare, for the ways people may live intergenerationally. All of these things have impacts on who is being affected. So there's also a disparate impact with this policy on our communities and also on children with disabilities. And then finally, there is this state-created danger. Generally speaking, our government does not have a duty to protect us, but there is an exception to that. And the exception is when the government itself creates the danger. So here we have a system where there is compulsory education. You have to send your kids to school. We have a system where there is no option, as Dr. Osgood mentioned, as to synchronous or asynchronous education. There's nowhere else for you to go. Even private schools are not an option for many parents because they don't come with transportation. They may have additional fees associated with them. If you have a child with a disability, you are required to check your federal rights at the door before you walk into one. That's not a tenable option for most and many families to try to pick up and go to private schools, nor are those schools better performing, or are they the schools that their parents want them to be in. And so that is not an option that people should have to have in front of them. So we are stuck with this state-created danger that our government has liability for creating. And so that's another way that this violates federal law. And then there's the state law. We in Florida, we have an incredible, powerful language in our Constitution. Unfortunately, we have a Supreme Court that doesn't believe it, and it's claimed that Article 9 of our Constitution, which deals with our education system, is not justiciable for the most part, which means that they think that a court is not capable of looking at it and interpreting it. Though there may be some carve-outs for that, but we're concerned about it. But there is a strong constitutional right for education in our state. We have a right to a free, high quality and safe education. And this is absolutely violative of that right to have a safe education. And then we also have the authority of local rule. As I mentioned before, this is an expansion that is not authorized in terms of the home rule that we have in our Constitution that's protected for our local elected officials to be able to make decisions. And then finally, one last point is that the way these regulations rolled out is violative of our administrative procedural requirements. You are not allowed to just usurp democracy and decide you're going to do something on an emergency basis, and that is not favored. You cannot just avoid all of the requirements of posting your suggested rules and having them go through the process where the public gets to question them. But that has again been what this administration has done. So we have seen one violation after another, after another, after another. And thankfully, there are advocates who are currently suing. There are many of us who are organizing to come up with additional suits and other kinds of advocacy, because absolutely, President Ellison, this is not within the bounds of our laws. And it is not something that we can sit by and allow to happen.
Thank you, Attorney Jackson. And so to our minority leader of the House, Representative Bobby DeBose, you know, it's been said that the legislative procedures have been sideswiped. He has just gone around you all in order to do, he being the governor, what he wants to do. Tell us about what your legislative procedures are and what he has not done when it comes to your illustrious governor there.
Thank you, Madam President, and to the panel. I mean, tonight, I just feel empowered just because of the passion we have for our young folks. This is what I would say is the governor's political theater, and he's been doing it. But, prior to, we probably had some political theater that was probably rated PG-13 or so, but we're looking at, R-rated political theater as it relates to the extent that he's going to jeopardize the lives of our kids. The governor issued this executive order because he lacks the authority to prevent our school districts from mandating masks. When we look at the state statute, specifically the section 120.54, section 2E, that talks about the rulemaking and the authority. What has happened is the basic rule for rulemaking is that the agencies can write rules and to clarify statute or explain statute, but they cannot expand on the statute. And that's what we have here. This emergency order, we're trying to now define COVID-19 harassment, as my school board chair stated. It's interesting too, and kind of in that same vein, we started talking about allowing this Hope Scholarship and listening to Bacardi talk about follow the money. And it just took me back to when we had this Hope Scholarship. We haven't reached but one particular session. We call it the bully bill. And it's interesting that the governor and at the time, Commissioner of Education, Corcoran, Speaker of the House, and we talked about this bully bill and this avenue to allow kids to take more additional public dollars to go to private school. And now the irony is that the governor is bullying our school districts and taking the same money to these private schools, and they're mandating the very thing that he's allowing the money to flow from, but he's not applying it equally and saying, okay, so if you think that our school district shouldn't receive funding because they're not following your order and they're taking dollars out and going to these private schools who are not following these orders, but that is okay. It's another example of the bigger picture. And I think, discussion is great. We're focusing on, but I think Bacardi really hit the nail on the head, because this is just act one of this political theater. There will be an act two, and so on and so on, and it'll show its face again and again. But back to Madam President's point, the governor has exceeded the state constitution, the statutes with this executive order. Yes, the agency can clarify upon the statute as far as the rules, but to expand and that's what they've done here, it's too broad, and there lies the problem. The legislature is in place, there's checks and balances within our government structure, and so the governor is going this route because he does not have the authority to prevent our school districts from mandating mandatory masks.
Thank you. I wanted to go back to something someone said earlier that almost made Dr. Major pass out. And I heard this theory before. I was down at the school board speaking and standing with Dr. Osgood on Tuesday. And so one of the parents did an interview, and I saw it in the hallway. And they said, well, clearly she received her medical degree from the internet, from Facebook. And she said that a child breathing in CO2 for 8 hours a day, having the mask, eventually is going to be harmful. So that equates to child abuse, because you can't breathe in all of the CO2. It's, triple the times that you normally would breathe and eat, and so on and so forth. So let's ask the doctor, who actually not only drove by, but spent some time in medical school. Dr. Major, tell us about wearing these masks.
That is not accurate. I'll just stop that right now. there's a reason why we started the age of 2, right? For the smaller ones, the babies, first of all, it's hard to get a mask on them, and you're not going to be able to get them to keep it on. And second of all, their breathing is different. We don't put masks on anyone that's less than 2. We're putting them on kids that are old enough. They know how to breathe in and out, and they know how to keep a mask on. So that is absolutely not true. And if that was the case, then those incredibly long times on the surgical rotation, then we would all be passing out. So that does not make any sense whatsoever. We breathe in, we breathe out. Parts of it goes through the masks. I know my face is hot. I'm allergic to the mask. So I wear 2 of them. And somehow I'm seeing patients all day with 2 masks on, a cloth one, and then my real mask on top of that, because I'm allergic to the other one. And I've done this during flu season. And to what Ms. Jackson had said, I've never gotten an infection from my mask during flu season. And there's a lot of flu seasons I've been through doing this. What I did get once, I didn't get the flu, but I got a really bad infection from a patient, then ended up with bronchitis, then ended up with a horrible sinus infection. And after that, I learned my lesson. And I wore a mask every flu season after that, even when I got the flu shot. And I never got an infection. Why? Because if the mask becomes soiled, I change it. Right? We don't reuse gloves. We don't wash them. We don't get blood on them and then wipe them off and keep going. You take it off. If it's soiled, you discard it. Right? If it is a reusable mask, you wash it. So that does not, really, there's no basis for that. And if that was the case, then we would all be passing out all over the place. Our lung capacities are much better than at 2 years old. Your lung capacity is much better than that.
Thank you. And I did receive a text from one of our judges, Judge Evans, Cal Evans. She says that his mother, sister, brother-in-law, and 2 nephews, 16 and 18, all tested positive yesterday. They are in Pasco County, Madam President. And he said his sister is an assistant principal. They all quarantine they started school. So that is another recipe for failure and for death if we are not mindful. And Doc, let's talk a little bit about, so these kids pick up and they're unvaccinated, or let's just say even though they are. So they go home to parents, grandparents, siblings. Many of people, particularly in our community, they may suffer from underlying conditions like diabetes or any other breathing issues, asthma, that sort of thing. What are the possibilities of them picking up infections or COVID-19 and then taking them home to their family members?
It's very high. Listen, as I was saying previously, our circle, right, is not just our household. It's everybody else. We go to the supermarket, gas stations, we are in restaurants, even the things that are basic necessities, we are in contact with each other. And every person that you come in contact with comes in contact with someone else. The people that are getting infected, even in our own health centers, it's often because of community exposure, not in the health center itself. We're all wearing masks, but they have family members who are becoming infected. We are still attempting to, strongly encourage as many people in our communities as possible to get vaccinated. But you all know we are still not where we should be with that. And so there are a lot of people who are vulnerable. Our community is also heavily hit by diabetes, high blood pressure, high cholesterol, and everything else. They have a lot of underlying conditions, which makes them more vulnerable. Obesity, which makes you more vulnerable. So many other things. And then when you add COVID to it, this is not a good scenario. The child goes out and get ill. I'm a mother of a 9-month-old. Okay, I did what I was not supposed to do. And I had the baby fall asleep with me in bed. No, don't worry. He went to the bassinet later on. But he got used to falling asleep in my arms. Now I can't get him to not fall asleep without being in my arms. If he was ill, let me tell you right now, there's no way for me to isolate him. He's going to be with me, which means I'm going to get sick. And then my husband's going to get sick. Everyone, my dad, who's older in this household, is going to get sick. So you tell all of the parents out there that their child gets sick, as Mr. Hosey said. How do you then isolate those children from the rest of the family? Part of the reason that we want to go back to in-person instruction, as we've all come to realize, CDC, the American Academy of Pediatrics, the American Association of Family Physicians, is that in-person learning offers just more than math and reading and science. There's a mental health component to that, you know? So it's important in its own right. So now there's a mental health component to separating a child from the rest of the family too. You know, and we should bear that in mind as well. I don't see how that would be possible. I know as a mom that I couldn't do it. I'm a mom, a scientist, and a doctor, and I could not do it. So I admire you, Mr. Hosey, for what you have been through. That's challenging, to say the least. But we really should get comfortable with the fact that our kids, just as how they're incredibly cute spreaders of the flu, this is no different. They will be incredibly cute spreaders of this as well.
Thank you. Judge Holmes, I believe we have some questions in the Q&A.
All right, Madam President, thank you. One of the questions is, I guess it goes to Dr. Osgood. She may or may not be able to answer this. The question is, I understand that many of the unvaccinated children are taking their mask off as soon as they get to the school, against the wishes of their parents. What actions are the teachers and schools taking to handle this type of problem?
So we have a discipline matrix. What the teacher does, if a child removes a mask or if there's an issue with the mask, they offer the child another mask, a clean mask. You know, our teachers are so resilient and they love what they do. So many of them have those little cute masks with all kind of different little fun things on with the kids. So they are able to get students to put on those masks. If a student just outright refuses and defies the teacher, then they follow the discipline matrix where they go to the office. A parent is called. If the parent doesn't respond, in all of our schools, we will have 2 nurses in an isolation room. So we try the path of least resistance first, because again, our goal is educating students. So we want to keep a child in school and keep them connected. Our teachers have relationships with our kids in a way that they're able to move them to a place where they cooperate. We have not had incidences when we went back to school or over the summer where we've had rudely kids that just wouldn't wear their mask or refuse to cooperate with the teacher. And that's why we have not had a tremendous COVID spread in our schools.
And let me just say that's what Broward County is doing. The NAACP sat on both the disciplinary matrix and the school code of conduct in anticipation. It was actually, quite frankly, at Dr. Osgood's request. We saw what the direction of the schools are going to go in before they close, to make sure that they were not, it wasn't escalated into something else. But I was watching CNN the other day, and not all districts are providing masks. Some of them have said the children are responsible for bringing their own masks. So I see a lot of my colleagues on I encourage you to see what the policy is in your school district, because that is not the case all over. Judge Holmes, next question.
Right.
Oh, can I just jump in on that really
Yes.
quickly? Because
Go
one
ahead.
thing I just want to point out about that question is that that's one of the real flaws with this this notion that you can have an opt-out of a mask mandate. One, that's not a mandate, but two, if you do have these opt-outs, the issues of enforcement become almost impossible, because you could not, without putting some sort of scarlet letter that would be deemed harassment on the children who are opted out, figure out who is supposed to be in a mask and who is not supposed to be in the mask. And we also know that children will follow their peers. And if they see other folks without masks, you're much more likely to end up with a whole bunch more kids without masks. So just wanted to point out that flaw in this notion of, oh, we're going to still let our districts decide. You can do a mask mandate, but you got to have an opt-out.
Thank you.
All right, next question, Dr. I'm going to change it up a little bit. There's a concerned parent. What's the best type of mask for children?
I'm assuming that's for me.
Yes, ma'am.
So
Yes, Doc.
the same mask that you're wearing is fine for your 2-year-old, for your older kids. They do have the really cute ones. Like you've probably seen them in doctor's offices, even if you like go to, a pediatrician's office. It's the same mask as ours, but it has cartoon characters on it. So those are pediatricians they're pretty keen on things. They know if they put bright colors and put cartoon characters, kids are gonna love it. So it's the same mask as ours. It's just that it's cuter.
Are the disposable ones any better or worse than the cloth mask? Even for adults, or for anyone, I guess I should say.
Well, the disposable ones have filters. The cloth ones don't. Some of the cloth ones are thicker than others. I have people who show up with like one layer of a handkerchief. Like this is not a mask.
Well,
so
I think they said if you can see through it, then that's not sufficient.
Exactly. So if you're gonna get the cloth mask, and they're much better now than they initially were, like 2020. So if you get a cloth ones, a lot of times they're already double layered or triple layered. So they've gotten a lot better now. If you remember back earlier on in 2020, a lot of them were really thin. We were still learning. They're much better now.
Or double mask. But let me ask, Doc, y'all taking that, Dr. Osgood, are you taking donations? We can get some of those smiley face masks and make it cute for your your elementary schools, or has the school board already purchased them? Because I really think the blue ones, make you look like you got something. So,
Yeah, the school board has invested a couple of $1 million in PPE for our staff and our students. I know I was kind of waiting on Madam President to give us some kind of project. We've been doing books at the Department of Juvenile Justice. So any organization, I'm the CEO of Modco, and I have thousands of these masks in my office at all the time, because on Trunk, of course, I have my mass street ministry that I have to go out to my brothers and sisters that, are out having their, adult beverages under the trees to make sure that they have their masks, because we care for our entire community. So there are masks available at schools for families that can't afford them. There are organizations all throughout the community. All of the Pan-Hellenic organizations have projects where they have masks. Now, you can't wear masks from the Pan-Hellenic with the Greek letters on it if you're not a member of the organization. I'm just saying, even if somebody give it to you, if you're not a member of the organization, you can't wear that mask. But there are all types of masks. A lot of churches have masks that they share. We haven't found that getting a mask is an issue. All of our bus drivers have this supply kit of masks. When they drop off a group of kids, they have to clean the buses down with different types of things that they sterilize them with before the next group, get on to the bus.
Also, there's another question. Bacardi, I'll throw this out to you, Ms. Jackson, but I'm going to answer it also if you disagree with my answer. The question is, can the governor be criminally liable for the death of people who die from COVID based upon his legislation, his orders, and what he does. And I'll let you explain absolute immunity.
Yeah, unfortunately, that's not the law, because people in their public offices have immunity, but I actually think he's acting outside the scope of his responsibility. So I might argue differently, and I turn it over to Representative to Senator DeVos to say we need to change that. So there should be some criminal liability for public officials who put people's lives in danger.
In that case, nobody would run for office. So certain officials, like judges, have absolute immunity. Police officers get qualified immunity. And they've been trying to work on this. So Representative DuBose, what y'all doing about this qualified immunity thing?
Well, I mean,
hold these people responsible.
Judge Holmes, to your point, people would question whether or not they should run for office, but maybe that's where we start. I mean, I think a lot of these folks, and even the governor, there's got to be something wrong. There has to be a character flaw in you to feel okay to use children as a pawn, to create your political theater. So maybe it is something that needs to be out there, and people really need to check themselves at the door before they put their names on the ballot. But as it stands, no, that can't happen to the governor, to elected officials. I mean, there's the other side of the coin, but this here, I just never thought that we would be in this space where we have someone that has a platform, that has so much power, that has such little regard for our future, because that's what our children are. They're our future.
Dr. Osgood? Oh, I'm sorry. You keep
No.
are you going to sing? I believe the children.
No, I want to know from the attorneys, in seriousness, I have two questions. The first one is, what legal recourse do I personally have that I'm being bullied, but I don't have access to a Hope Scholarship? And secondly, what do I do when the district is now, where I'm from, we call it being strong arm robbed of money from our general fund through this game? There has to be something illegal about it. You can't just take people's money on the street. So how could you in an office take the taxpayers' money because you disagree with somebody?
Bacardi, I'll let you go, and then I'll give my thoughts.
Yeah, we have been, strategizing and looking at all kinds of legal issues around this. And, I agree with you, Dr. Osgood, there is something really off about being able to take public funds and use them for retaliatory purposes, because it clearly is not advancing any kind of public interest. The challenge I think we have right now is that they not only did it, I think if it was just through a Department of Education regulation, we'd have a really, really strong argument. Right now, they also have a regulation from the Department of Health, as ridiculous as it is based on the pseudoscience it's based on. They do have the authority to make these requirements. There is a statute that allows the governor to withhold funds, and their discretionary funds. And so we are looking at, the ways that can be challenged, especially when it's being done without there being any kind of declared state of emergency. It does seem to exceed executive power and authority. And so that's something we are continuing to try to understand and examine.
And I agree with Ms. Jackson on that. Ms. Jackson and I threw out a hypothetical to her before we began this program that, the governor is a lawyer, believe it or not. He is a member of the Florida Bar. And the bar has certain requirements for its members. And so she said she would look into that the same way New York has suspended Rudy Giuliani. But the governor is really not acting in his capacity as an attorney, because if he were, he would read the statutes and the Constitution, and he would know you don't get to do this kind of stuff. But since a certain person moved into the state of Florida, he's starting to sound a lot like a number 45. What do you think, Bacardi?
I tend to agree with you, even Stalinesque. I think part of the attack that we see on history is because we have people who are desperately trying to relive it, and that history is really, really morbid. So, this is the moment for voices, because if we stand silently by, we will see our democracy slip through our fingers. And I think a lot of times we think it is more resilient than it is. We think it's been longer lasting than it is. But our democracy is still a fragile thing that we have to diligently protect.
Well, before I go to Dr. Osgood, I wanted to throw in something that I was thinking about. There's a concept called in loco parentis. And I don't know if anybody has brought that up, but I remember a couple cases that I had to preside over where children needed medical care. One dealt with a Jehovah's Witness issue. They didn't want blood transfusion for religious purposes, but the hospital said, we can save this child if we do this. So a lot of times courts have to make these decisions for the parents, and the parents were there, okay? Objecting like these no mask parents are saying. And sometimes somebody with some good sense has to intervene and say, hey, look, this is like a death wish. Your children can die. You can die. And so it's not fair if you have a death wish to put other people at risk because you don't care. So I'm thinking maybe a argument, it may not go, but there's a case called In the Interest of Ivy, IVEY, 319 Southern 2nd 53. It's a 1975 case from the first DCA. It may work in this instance where the school board is acting in loco parentis. So I'm just throwing that out there. It's novel, but if I heard that argument in a courtroom, I'd probably say sustain, grant your motion. All right, now, Dr. Osgood.
Yeah, I want to add this to the conversation because this is another thing that's happening to districts that we're not vocalizing or we're not paying attention to. So the American Rescue Act was put into place and money was given to the state government for local school districts. I know that the FEA gave the state of Florida at least $15 billion, and there were other funds. School districts have not gotten that money. So you already holding on to money that belonged to us, and now you're taking more money away. So I don't understand how the governor can just hold on to money that was given to him to give to local school districts. We need those resources in schools. Those are funds that we can use to incentivize all of the staff to get COVID vaccinations. Those are the funds that we can use to pay people who can, a lot of our teachers and bus drivers and cafeteria workers, they can't work their second and third job now because of COVID. Those jobs have been eliminated. So we could have after school activities and things that we would be able to give them extra stipends, give them additional funding to help us during this critical time where we actually need more hands on deck. Many of our school districts are down with teachers and bus drivers. We just voted on Tuesday to increase the starting salary of bus drivers to $16, I think, and 20 cents. If you have a CDL license, you need a job, go to browardschools.com and click jobs, because we have to pay people more to get them to engage, to get them to work because of the horrible time that they're in. So while that money is sitting in Tallahassee, I don't know where the interest is going. I don't know why we're not getting it, but school boards have to start sounding the alarm about these funds that was given to the state to give to us. And I know we're in Florida where, for whatever reason, the last, few governors have chosen not to even expand Medicaid to help our people get proper health care. But we have to pay attention to the budget and these dollars that people are sitting on and playing games with and not giving us the resources that we need when we're already underfunded. So for you attorneys and those of you that are out there on Facebook, all of you that are listening, there is money that the governor has that was given through the American Rescue Act through President Biden and Vice President Kamala Harris's American Rescue Plan to help us during times like these that we have not gotten in our bank accounts in school districts.
Maybe this, your board attorney can take a look at that and see what's going on with that. And before
Wrap up, Judge.
can I leave it? You said I could quote one scripture.
Okay.
And Bacardi summed it up. It's always with the legislation and what's going on in this state, always follow the money. Follow why these people are doing and what their motivation is. And so I looked at 2 Corinthians chapter 2, verse 11. It says, lest Satan should get an advantage of us, for we are not ignorant of his devices. So we're not ignorant. The fact that you all 90 people plus are on this tonight, we're not ignorant, and you're here. You've got the knowledge. Start speaking up. You can say things that Dr. Osgood cannot. You can demand to know where the money's going. Follow the money. That's what gives you the right as a citizen of this state. Okay, and even though the Republicans don't like to follow the Constitution, it is still alive and well. Dr. Osgood, Title 9, paragraph section 4B, gives you and the school board the absolute right, and I'll quote and then I'll shut up, to, number one, operate, control, and supervise all free public schools within the district. And with that, I turn it back over to you, Madam President, and thank you.
Thank you, Judge. So we'll have a few closing remarks for our panelists. Let's start with our parent, Mr. Hosey.
Yeah, so I mean, I'm honored to even be on this panel, speaking with everyone here and listening. And the key thing is organized and focusing that energy on preventing this from continuing. And as a parent, I'm doing everything possible, getting organized with other parents, forming a group, calling out and getting assistance and speaking to our own North and South chapter of the NAACP in Brevard. But just continuing to fight and not give up and hold our local officials, the governor, all accountable for what's happening and keep pushing them to make change and do what's right.
Thank you. And I'm gonna text you. You also have a central Brevard branch. I will text you that number as well, Mr. Hosey. Thank you so much. We appreciate you. Dr. Major Moore.
Hi, everyone. First of all, thank you so much for having me. It was an honor. I'm gonna tell my husband all about this as soon as we go. But if I had any parting words, it's this: please let science be science. And that, at the end of the day, when my patients walk through the door, most do not have very good health literacy. And it's my job to stop and help them to understand as much as possible. And that's a responsibility I take very seriously. Sometimes maybe a little too seriously, but it's important. There are a lot of people that are dependent on us to be honest and to be truthful and to speak to the science and to follow that science. And it changes. Science changes all the time. It's supposed to. As we learn new information, it's supposed to change. That's a part of the process. If you were doing research and you hated change, you would hate your life every day. That's a part of science. So as it changes, as information changes, and as we learn more, it's supposed to change. And then the policies are supposed to change to match accordingly. So I think it's important that we stick to the science, we stick to public health measures. This is not going to be the last pandemic. And I think we need to ask ourselves, do we really want to have another discussion about masks next time? Or do we want to have our systems down pat, know what it is that we're going to do, and be able to get on board and do what we need to do and not be in the same place? I would think we would choose the latter, to be prepared and to be ready. Our kids are dependent on us, and they're looking forward to going back to school and seeing their friends. So I would say that our best measures right now is to really look to the Centers for Disease Control and the American Academy of Pediatrics, because they're going to follow the science, and it may change, but don't get frustrated. Change with it, adjust with it. Okay, that's what we do. That's medicine, that's public health, that's science, that's how it works.
Thank you, Doc. Our own school board chair extraordinaire. Let me just say, we are so unfair to her, to President Nweze. She is assigned a district, but she has become everybody's school
At
board.
large.
So we call her, yeah, we treat her like she's at large because everybody in Broward County calls her. And though she might say, well, I'm not your school board member, you say, we understand, Doc, but this is what I need. And so she's never failed to respond. So Dr. Osgood, your
Yeah,
rep.
thank you, Madam President. Thank you for this forum. And someone put in the chat, the governor did give $1,000 bonus to teachers and principals that we appreciate. But if he released that,
Dr. Osgood, he didn't give y'all that. That came from the Biden-Harris
I'm
administration.
gonna get there. I'm gonna get there. But if he releases that other money, it would allow us to give that $1,000 or something to bus drivers, cafeteria workers. It causes divide in the school when you choose a group that you're gonna give money to, and you leave out all the other people, the ESPs, the people that are working just as hard. My closing remarks is, if you're in Broward County, wherever you are, and you have not been vaccinated, if you have kids that are 12 and older, I beg you from the bottom of my heart to get vaccinated. I don't want to lose you. I don't want you to get sick with this virus and have some lifelong complications. If you don't trust the science, you don't trust the medicine, I got vaccinated. Trust me. Please, please, please get the vaccination. If you need help getting it, I can make you an appointment. We can set you up to come to Modco. You can call us at 954-764-6488, 954-764-6488. We have pop-up vaccination sites all around our community. The first Saturday in September, we will have one at Mount Olive. We just had one at First Baptist Piney Grove. We can come, if you're in an apartment complex, we can come set up for you to be vaccinated. I don't want to lose you to this pandemic. I don't want to lose our kids. Our kids are our future. If we don't protect ourselves from this pandemic by getting vaccinated and wearing masks, we will devalue this whole experience as citizens, because if a child dies, then that's perhaps an invention that we've lost, an entrepreneur venture, a doctor or a lawyer, the next local elected official we've lost. We have to protect ourselves. We have to get the vaccinations, and we have to make sure that we're wearing our masks and washing our hands. Don't meet in large crowds where people are talking. This thing is airborne. You can't see it. We have to protect ourselves. We can talk about the governor and what he's not doing, brothers and sisters, but there are some things that we can do, and we have to hold each other accountable. I love you from the bottom of my heart, and I don't want to lose you to this pandemic when you don't have to die from it. You don't have to get sick from it. There were many Black doctors involved with creating these different vaccinations that's going on. That's new. We don't normally have doctors that are in the loop with this stuff. But when you do the research, there were many people that look like us that were a part of developing these vaccines and a part of this science that's coming forth now. I don't want to lose grandma because you didn't get vaccinated and now she has COVID. And because of her age, although she's vaccinated and the other things that she got going on, or granddaddy got going on, they end up dead. Please get vaccinated. Please wear your mask. Don't believe the stuff you're hearing online. Don't listen at people. We had a doctor, a legitimate doctor, tell us tonight that the science is real. So I love you, and I need you to show me some love back by getting vaccinated and wearing your mask.
Thank you, Doc. And several of our school districts do have mobile units. If they don't have it, please follow up with your superintendent or your school board member to get those mobile units at your local schools. I do know that Miami-Dade, for example, has the same thing that both your children and adults can be vaccinated at our schools. Attorney Bacardi Jackson.
Thank you again so much for having me. And I want to also just say thank you to the almost 90 folks who've been on this call paying attention. And I want to lift up, something that Dr. Osgood said earlier is that when they come for us, we need to show up, and they are coming for us. They are coming for our children. They are coming for our communities. They are coming for our lives. We need to show up. We need our 7 socially distanced buses showing up in Tallahassee. We know committee meetings are starting not far from now. We know there's a new session, and we know there's an election coming up in 2022. We need to be present for them. While we've been talking about litigation strategies, we work in an integrated advocacy model. We know that we have a lot of power, even beyond our courts. Even our judges are swayed by when people show up in courtrooms. We can show up in all of these venues, whether it's in a courtroom, whether it is in a hearing, whether it is the Department of Education board meetings. We need to show up and voice and speak in public comments, submit them. We have power, and we will lose that power if we don't use it. So I just want to encourage everybody to please pay attention to what is happening. Do not let it happen on your watch. All of us are accountable and responsible for the lives of our children. And I just want to thank again Dr. Osgood and all of the people on the board who have had the courage to stand up, even in the face of personal attacks and having their livelihoods threatened. I want to thank you for your courage, but we cannot let them stand alone. It is our obligation to be there and show up for these hearings and show up for comments that, the governor's office should not be able to do business because his phone should be ringing so much. So, I really do think that, when we do show up, we can change things, and it just takes some of us. And the final thing I'll say is equip your children to be advocates for themselves. When they are walking in their schools, when they are even if they look at the fact that they are the ones who are in charge. When you go to these state legislatures, when you go to the federal legislature, those are their employees, and that's a lesson we need to teach them, that they can use their voices to speak up as well. So thank you again for having me, and thank you again for all of your courage.
Thank you so much, Attorney Jackson. Representative Bobby Dubose.
Thank you, Madam President Ellison, for what you're doing here. It's always great to see Madam President Nweze. I'm just looking at this panel. I see Roosevelt Walters. I remember he was president of the branch when I was president of Youth Council. I see Pamela Birch Ford, who really helps tie us this together in Tallahassee. Bacardi, I'm always just encouraged by your words, and I'm going to come back and close, kind of pick up where you left off. And to my school board member, man, I'm just super proud of you, just standing up for our kids. I'm not only wearing a hat as the minority leader, but I too have kids, and everyone in my house is vaccinated except for one of my kids, and that's Jacob, because he's 7. And I'm always uneasy. I'm trying to figure this thing out. I'm trying to be a leader. But at the end of the day, I'm a parent. And so I can only imagine me being plugged in, how I'm feeling and trying to maneuver through this thing. So I thank all of you, Dr. Major Moore, Mr. Edwards, and of course, my Judge Holmes, for doing this and continue to do this. But I think the big picture here that we really need to focus on, again, I said this earlier, this is Act 1. What is going on is they are seizing the opportunity to push their agenda, which is an agenda that's adversarial to our community. We've had conversations on other platforms, the Baker Act, we talked about voter suppression, Jim Crow 2.0. Folks, again, as you follow the money in this, you'll understand that it's a bigger picture. And so we must come together. We must show up. We must demand that the folks that we elect make sure they serve our community. We have to continue to do this. And what I love about this is that this is an ongoing series. I think Madam President Nweze said, our branch president, Ellison, must have a crystal ball or the foresight to see that we need to put this in place so we're not just responding at the moment, at the time. This conversation is growing, and all these folks who are out here, I want you to hear, if this is your first time or you've been on multiple series, to understand there is a lot of work to be done. And Bacardi, thank you for saying that we are all accountable. Every single one of us carry a title, whether it is, like I said, I'm a state rep, but I'm also a father. I'm also a product of the community. So this is something that we need to continue to strategize. And I think Dr. Osgood was talking about funding and all that stuff. And I remember you used to say it, and we kind of jokingly, but I think it's time for us to look at, suing the state about education. That's where we really need to start and make sure we demand, because when you take money from our district, people may look at it as an overall deal. But again, in our communities, we say it when everyone else sneezes, we got pneumonia. And so removing X amount of dollars, it may be a little bit over there, but it may be a huge impact in our community. So I'm going to leave you with that example because we generally all use that, but you got to understand all of this are moving parts. They are seizing the opportunity. When you go back and you talk about the Hope Scholarship, the argument there, that was a long play. The parental rights, these are moves that are constantly being played and put into play. So when the opportunity is there, they pulling from all these different variables and tools they have. Folks, our lives literally depend on it. We still are dealing with modern day lynching. We're still protecting our kids. If we go back and look at what our ancestors dealt with, it's a new day, but it's the same old BS. So we got to be all accountable. We got to all understand, stay plugged in, stay engaged. This is just act one. Trust me, as soon as we move through this, no, it's not going to start. There are other things going on. We got to continue to organize, strategize. We got to put our things in place and think forward. And I'll leave with that. And again, I thank you, Madam President. I think the NAACP, we needed you back then, but I feel we need you more today than we did yesterday. And I thank you for always filling the gap, standing up, fighting for us, providing the platform. Because folks, we got a long way to go.
Thank you, Representative. And before I go to our leader, President Nweze, I want to just give a shout out to our own Pamela Birchford, who is just extraordinary in her effort. She is always on the case, and she, unfortunately, she gave us her cell phone number. So anytime we think of anything, we are forever calling her.
24/7.
But she always answers the call, and it's always just so. Pamela, if you would just say just a couple of things to our people, and thank you for, for everything that you do on a daily basis.
And nightly.
That's true.
Late night.
Thank you, President Ellison, and of course, our statewide president, Dr. Nweze, for having me involved in this process. I just want to say that the destruction of the public school system has been in the works for decades. But I am pleased and excited to be in this fight with each of you on this call and in the audience. And as Dr. Osgood said, and echoed by Bacardi and Rep. DuBose, when they come for us, we'll be there.
Thank you so much. And our own Dr. Adora Nweze, who is at the top of the food chain for all of us, our fearless leader. Madam President, we want to hear from you. Thank you.
Well, thank you very much. Talk about a top leader. My goodness, you blew it out the water tonight. I'm telling you, I'm so excited. I can hardly wait for the next one to start. To each one of our panelists, I just want you to know that the NAACP is very, very proud of you, and you can depend on us. As a matter of fact, we are a part of you. So it's easy for us to work this out together. But let me tell you two things I want to say, if I may, Madam President. One, there will be an op-ed piece in the newspaper very, very soon. And that will give you the view of the NAACP as it comes to masks and COVID. We have been working on this as an organization before day one. So this is a part of our program, and our units all know that their role right now is to work in the community. And that's why you keep hearing me say what an outstanding job that our President Ellison is doing and has been doing. I also want to say about Pamela, I cannot not say anything about Pamela. I'm one of those persons, and we in the NAACP, I'm not lying to you all. We call it 24 hours a day, 7 days a week, no lie. That's how this whole issue regarding our children is grabbed us in the NAACP, and we can't hardly move. We don't know which way to go, but we know we got to go. We got to fix this. We got to save our children. We got to make sure, Dr. Osgood, my soror, we got you. We got your back. Don't even look around, because we're there. And for each of you in your various roles, you can depend on us. You really can depend on us. And thank you so much for the very positive words. Thank you for allowing me to be a part of this. The Florida State Conference did join you tonight, and our representatives, I'm sure, are still watching, because they know that when anything happens in the NAACP and we're told, we're going to be there. Thank you again, Madam President.
Thank you. And I see in the comments, yes, shout out to the Zetas, because you up in here, the Deltas, the AKAs, I see Alphas, and I see Kappas. Now, I don't see anybody else, but those are who I see, and those are our constant partners, and we say thank you. And with that, we will close out as we always do. Minister Edwards, if you would take us home.
Let us pray. Gracious Father, we give thanks to you for what our eyes have seen and our ears have heard. Now, God, as we prepare to depart from this call, but never from your presence, I pray, Lord, that you would have us to be strong and courageous. It is the hour, Lord, when the preacher must stand up, when the NAACP must stand up, when the Divine Nine must stand up, when the Southern Poverty Law Center must stand up, the judges must stand up, the representatives and state legislators must stand up. God, it's time for parents and doctors and all who are involved. It takes our whole community. God, on this night, I pray that you would let Dr. Osgood know that, Father, not only are you on her side, but we're on her side. Give us the strength to stand, oh God, and let us be mindful of the children that you have entrusted to our care. Bless these, your people, oh God, and let your peace abide with us. In Christ Jesus' name I pray. Amen.
Amen. Thank you, everybody. We appreciate you. Bye-bye.